right. Night, everyone. We've got the exciting topic of infection control to talk about tonight. So if you have any questions at any point, just go ahead and jump in, and we'll get started. Can you guys all see that?
Yep.
Yep, I can see it.
Perfect. All right. All right, so starting with infectious diseases, they're all caused by pathogens, any microorganism that can cause a disease. Types of pathogens can include viruses, which could cause like Hep B, colds, AIDS, bacteria, might cause tuberculosis, fungi, associated with things like athlete's foot or ringworm, or parasites, which might cause something like malaria. Diseases can be transmitted a variety of ways. Inhalation, i.e. COVID, ingestion, that might be a variety of like foodborne, like food poisoning type things, or contact, which can be either directly coming into contact with a sick person or indirect, like coming into contact with a surface that a sick person had come into contact with previously. So an infectious disease is a disease resulting from the invasion of the body by a pathogen. A communicable disease is specifically one that is readily spread from one person to another under certain conditions. So disease can be infectious, but not communicable. There are some diseases that are very hard to pass from person to person, whereas some, like the common cold, pass very easily. So your body has a variety of defenses against pathogens. You've got skin. Unbroken skin is the body's first line of defense because organisms cannot pass through unbroken skin. And the skin has some normal secretions that kill bacteria. Your eyes are protected by the motion of eyelids and the washing of tears. Are you not seeing the slides changing?
No. Click down on the lower right hand of the screen. There's that little how to explain it? It's in the lower right hand, just to the left of the minus sign.
So what are you guys seeing? Are you seeing my screen at all?
We do see your screen, but it's showing like the edited version. So
yeah, let me try again.
there you go.
Is that working now?
Yep.
Yep,
Okay.
Works good.
Looks the same on my end as it did before.
Here we go.
All right. So we just talked about skin. Now moving on to eyes, protected by the motion of eyelids and tears. Lungs, the cilia in your airways can help catch organisms, and then your cough reflex and such can help expel them, as well as the complex arrangement of your nasal passages helps prevent particulates and such from actually making it all the way down into your lungs. Your GI tract is very acidic, which can kill a lot of things before they can ever be absorbed. And then should anything actually make it into the bloodstream, you've got your immune system, which can protect against actual infection. So immunity is the resistance to an infection or disease, which can be active, coming from vaccination or recovery from being infected, or passive, which is when it's transferred from mother to child. So factors for disease transmission, the dose. So whether or not you can come into contact with a pathogen but may not actually get infected if you don't come into contact with enough of the pathogen. But that depends on the different pathogens. So as it says, Hep B may require coming into contact with only a single virus to cause an infection, but HIV may require over 100,000. So virulence is the ability of the pathogens to survive outside the host or reservoir. So certain things like HIV do not survive well outside, but things like norovirus or Hep B have been found to be infectious when left on a surface for, in the case of Hep B, up to 7 days later. The mode of entry can impact things, how it enters the body. And then the individual host resistance. So the host also has to be susceptible before a pathogen can actually cause an infection. So we're going to talk about some specific bloodborne pathogens. So bloodborne pathogens are present in blood or open other potentially infectious materials. Things that we're most concerned about are going to be your hepatitis generally and HIV. And there's a list of some other potentially infectious materials. So these are bodily fluids that don't have the risk for specifically bloodborne pathogen transmission, unless, in the say of saliva, unless there's blood in the person's mouth. This isn't to say that these things can't transmit other diseases, just not bloodborne ones. So transmission of bloodborne pathogens, generally, the bloodborne pathogen is going to come into contact either through a break in the skin, through your mucous membranes, like your mouth or nose or around your eyes, sexual contact, or there's some other modes. So risk of transmission involves the specific type of pathogen, the route of exposure, the amount of pathogen in the infected blood. So sometimes in the case of HIV, if the person's on the proper medications, their viral load will be so low that there's a pretty low risk, even if you were to get exposed, that you would actually have any risk of developing an infection. The amount of blood involved in the exposure, whether there was treatment given afterwards, as well as the specific individual's immune response. So occupational transmission, that's what we're going to be talking about tonight. It's kind of our risk of getting any of these things. So the risk of infection following an exposure for Hep B is 6 to 30%. So that's one of the ones we're more concerned about. Hep B, 0 to 7%. Whereas HIV now, with all the various treatments we have, it's an under 1% chance that you would get it, even if you were exposed. So window phase, that's the time between exposure and testing when there would be enough antibodies present. So kind of like we've been talking about with COVID, just because you're exposed doesn't mean you would immediately test positive. You would have to allow enough time for the infection to develop for it to actually be testable. Incubation period, that's the time between exposure and the development of symptoms. So hepatitis viruses, specifically B and C. Viral hepatitis attacks the liver. It can be acute or chronic, and you can have liver damage that might be mild all the way till fatal. Signs and symptoms can be flu-like, fatigue, abdominal pain, loss of appetite, jaundice, which is the yellowing of the skin, and joint pain. There's a vaccine for Hep B, which hopefully everyone has. There is no vaccine for Hep C, though they are starting to come up with better treatments for it. Some people may be carriers. The infection can be chronic, and they may not necessarily have noticeable symptoms for years. And it's estimated that 1 to 4% of healthcare workers would test positive for Hep C if they were tested. And HIV. It's a virus that attacks the immune system and destroys its ability to fight infections. So then someone might become severely sick or die from a secondary infection that they would normally be able to fight off. Other infectious diseases, meningitis. It's an infection of the layer covering the brain and spinal cord. It can be viral or bacterial and comes in a variety of types. Signs and symptoms can be headache, neck stiffness, fever, confusion, vomiting, photophobia, and phonophobia, so discomfort with light and sound. Generally transmitted through respiratory droplets or nasal secretions. Meningococcal is specifically a bacterial infection, fast onset, and may develop into meningitis or may not, and it can be very fatal if not caught early. But a lot of times it doesn't actually, so subclinical mucus infection, so it may not actually develop into anything if the dose is too low. TB, bacterial, it's not a highly communicable disease. People can have it, but not have a viral or a bacterial load high enough to transmit easily. Exposures through inhalation of respiratory droplets. If you are treating someone with suspected TB, put a mask on them, wear a mask, use the vent in the ambulance, similar for when we're transporting COVID patients. Preventing exposure and infection. So treat all blood and any infectious type materials open as if they were infectious. Some patients will tell you if they're HIV positive or if they have hepatitis, but just generally we're going to treat every bodily fluid we come into contact with as if it was infectious. Any non-intact skin should be covered with a dressing. So if you have a cut, scrape, anything open, especially anything, arms or hands, where you're more likely to come into contact with bodily fluids, those should be covered. Make sure you wash your hands frequently. Always wash your hands after you take off gloves. Make sure we're wearing appropriate PPE, which means gloves, goggles, making sure we've got any broken skin covered, mask, gown, booties or head coverings are also an option. And gloves and eyewear should be worn on every EMS call, and currently masks as well. For a suspected flu patient, or in this case COVID patient, gloves, iPro, and N95. If you didn't get a flu vaccine, you'd be wearing a mask on every call during the normal flu season. Now we're wearing a mask on every call. Sharps. Any object that can be reasonably anticipated to penetrate the skin. Most of the time for us, that's going to be needles, but it also has the potential, the vials that our medications in our glass, they can break, so they can also become a sharp. There's thousands of needle stick injury reported every year. Any contaminated sharps injuries must be reported. This is why we try to be very careful when we're handling sharps in the ambulance. So if someone's, say, passing you a needle to get a CBG, just be careful with how you're passing things around. They are protected, which was designed because needles used to just stay open. You would slide the catheter off after you started the IV, and then you would just have a sharp. But then due to, accidents and whatnot, a lot of healthcare workers were getting accidental sticks with those contaminated needles, leading to disease transmission. So then they started designing various IV type catheters that essentially either retract or do something like that to prevent the risk of getting stuck. So put all sharps in a container as soon as possible and get the CBG, then put the sharps away. Recommended vaccinations would be Hep B, flu, measles, mumps, rubella, varicella, Tdap, so that'd be your tetanus, and meningococcal. Decon. So cleaning, these are kind of levels: cleaning, disinfection, high-level disinfection, to sterilization. So if there's a blood spill, use an appropriate thing to clean it, more than soap and water. You're gonna wanna use a disinfectant. Make sure you're wearing PPE to clean it up. Clean the spill, put any towels or whatever in a biohazard bag, and then make sure you wash your hands. If your clothing gets, if it's a very small amount, then you can wash at the station. But if you get significant exposure, then we can also get our clothes sent out for cleaning. Don't take it home and wash it. This is going to talk about in the case of an actual exposure. An exposure is when there was any blood or open contact with either broken skin, eye, mucous membrane, so like the inner surface of the nose or mouth, a needle stick, or a bloody human bite. So if you got someone else's blood on intact skin, so not broken, that doesn't count as an exposure. You just clean your skin and you are good. So if it does come into contact with the mucous membrane or non-intact skin, you make sure you rinse your eyes and mouth, blow nose, try and clear all that stuff out, wash and rinse the exposed surface, and then report to the supervisor, and then potentially seek medical attention. So we'll take care of any first aid we need to, report the incident to the company officer and or battalion chief. For us, our infection control officer is going to be Cliff. Make sure we maintain the person's confidentiality and privacy. And then we'll take care of organizing any testing and make sure we fill out the exposure paperwork. Can anyone tell me where exposure paperwork is? No. All right, so we should have a pamphlet in all the rigs in the clipboard. So the next time you're at the station, make sure you take a peek at that. So there's no automatic work restrictions unless you need something like sutures. An infection control nurse will make arrangements for labs to be drawn on the patient. And then the report will be filled out by you and by the nurse, but Cliff will walk us through that. So you may not necessarily have to report to the hospital or clinic right away, because this isn't an immediately time-sensitive emergency for the most part. They're going to test the patient who was the source of the exposure, and then if they come back positive or something, then they'll determine the next steps there. So there's the Ryan White notification law that mandates EMS personnel can find out whether or not they were exposed to life-threatening diseases while providing care. So my understanding is the patient can't deny being tested if you were exposed. And then certain types of, if they test positive for something, there's certain diseases where you may be asked to take prophylactic medication that would help prevent disease transmission, or perhaps you have to wait until you've hit the testing window. So these are presumptive diseases for EMS providers, meaning that it's considered a workplace disease, and they, like your employer, i.e. the fire department, would have to prove you got it somewhere else, but otherwise it should be covered. So that'd be like HIV, your hepatitis, TB, and meningitis. So any questions on the bloodborne pathogens?
Nope.
everyone familiar with our COVID protocols and the Canary Protocol and such?
You gotta send one person in beforehand, all masked up, and take temperatures and see if they've been exposed before anyone else comes in.
Yeah. So if either the patient has any, like, we send one person in first, fully gowned up and everything, check a temperature, check for respiratory symptoms and any known exposure. Now, if they do have a fever, what's that change or respiratory symptoms?
Everybody else has to gown up and dress accordingly with proper PPE.
Yep. Yeah, so then everyone's going to be in full PPE, and then we're also going to try and minimize the number of people that come into contact. So we don't need to have the whole crew inside. We'll try and keep people out. I think that's about what I have. I did put a quiz on in the Google Classroom.
On the quiz, there's nowhere for us to put our name.
That was
Will it like register when we turn it in?
Are you turning the names in to Kevin, Cassie?
Can they hear us?
Yes, they can.
Oh,
Yeah, we hear you.
all right.
Are you turning the names into Kevin?
yes, I can. I think I.
Where do I find the quiz?
Might be able to add a name question.
But the plan is, once we're done with this, I'm recording it right now, so I'll combine this with the assignment, so you should be able to access both things.
Okay.
That makes sense? And then I'll also put it on Target Solutions too, if you want to access it that way.
How do we access the Google Classroom?
Either a invite from one of us, or you put in the class code. I can resend out the invite.
Mistake, just sent it.
Thanks, Mistake.
Okay. And then I get an email and accept it that way. The good thing about being on Google Classroom is that anytime Niren posts something or I post something, you'll get an immediate notification on your phone. So it's a good way to stay in contact. And also, it'll give you a fresh new link every month for OTEP.
Okay. Well, you made Dad Myron, and hopefully he'll have his password and know how to turn his phone on by then.
Oh my God. Yeah.
Can you
work on
hear me? So the link that I put there is the PayPal link for the benevolent fund that I run. Again, if you decide to go that route, just remember to put in memo that it's for this route.
Okay, I'll get a hold of you, Chris.
All right.
Did everyone see I added a name line to the quiz?
Yeah, it's on there. Thank you.
Can you handwrite Myron's name in there, Cassie?
Oh, jeez. Thanks. So is that on the computer somewhere? The quiz?
Yes, it is.
It's on the Googles, Myron.
What?
It's on the Google.
Oh, G. Well done.
Oh man.
to sign off.
What?
Just follow. Mashinko, did you put that out for everybody? The link? Okay.
He's nodding his head yes.
Yes.
I hear the rocks clinking.
Oh, I'm not hammered yet.
Oh. Hey, there's,
Bill Hayes.
yeah. He looks pretty happy.
You guys can't take the quiz together.
100%, yo.
Oh, you want us to take it now?
What were
You
the
don't have to.
What are you waiting on?
The result.
Oh, well, duh.
Well,
Okay. Let me go out and find it.
Okay. You look like you're having too much fun, Matt.
Myron and Charlie are cracking me up.
Myron always cracks me up.
Especially the fact that they can't find the mute button.
Okay, you gotta wait till the mic's on before.
There
you-
it is.
Yeah.
aha. I guess.
Find it again.
Can they hear us? Can they hear us?
Still trying to.
Anyone had any interesting calls recently? No? Nothing?
I went into Wafer Tech for the first time for a chest pain.
Well, not sure I've done that. No, I don't think I've been away
The
from
call itself wasn't that interesting, but seeing the inside of that place was.
Now talk.
Is that place all spotless, clean, and wait for that?
Yeah.
Yeah.
It was actually a really nice campus.
Oh,
We went up to their little EMT room and saw their air packs and radios and all their tools and equipment they keep up there.
wow.
Whatever their first aid room, ERT room.
Mm.
Are we all done or
Yeah, I think that's
Matt,
all I have. So,
okay?
thanks, Cassie.
Thank you.
yeah.
Thank you.
no problem.
Thanks a lot.
Chris.
That's very good.
Hi, Rich.
Thank you guys.
I miss you.
All right. See you guys.
See you guys later.
See y'all.
Bye.